In this presentation, we will be looking at elbow dislocations and subluxations. The brief anatomy that we've kind of gone over in class would be, there's three bones, humor, ulna, and radius. The three joints, humero-ulnar, humeroradial, and ulnoradial. A lot of many landmarks like the grooves, the condyles, epicondyles, trochlea and capitulum, coronate fossa and process, and the olecranon process. Different muscles you see is the biceps, the triceps, brachialis, brachioradialis, supinators, and your pronators, and your flexors and extensors. And you have, your three big ligaments, the UCL, RCL, and annular. There's a lot of different pathology that you can see with predisposing factors, and that is like if you have a lot of joint laxity, previous dislocations, poor mechanics, whether that's throwing or any like upper body movement. And then a lot of times, if there's a upper like arm fracture, that's a lot of times where you'll see elbow dislocation. Your MOIs that you see is falling on outstretched arms, having a direct impact, or like any motor vehicle accidents. And this ends up being like the second most common major joint dislocation behind the shoulder. There's many different classifications for dislocations. One grouping is whether it's simple or complex. And so a simple dislocation would just be no ligament ruptures, no fractures. Complex dislocation means that there was something else like happening, whether there was a fracture, a ligament rupture. And then you have kind of like the direction or the way it was dislocated, whether it was posterior, anterior, lateral, medial. Your posterior is probably going to be your most common. And then there's the most rare dislocation would be, it's called divergent. And that's where the ulna and the radius are kind of separated apart. And you can see that in the bottom right picture. So like one goes medial, one goes lateral, and they kind of diverge. And then the last one would be a radial head subluxation, where the radial head is kind of like forced below the annular ligament. Signs and symptoms you see for dislocations is severe pain in the joint, a deformed elbow, and that usually means that something bad happened, whether it's like a complex dislocation, whether it's a rupture or a fracture. Protruding olecranon usually indicates a posterior dislocation. And then if bilaterally, if your forearm is shorter than the other one, that usually means it's a posterior dislocation, or if it gets longer than the bilateral comparison, then it is an anterior dislocation. Management and treatment, immediate care is we need to protect the joint, immobilize it, and send them straight to like a referral to the hospital. Typically, they will do imaging right away to rule out any fractures, anything like that, before they even think about reducing. And then they also want to look at like the radial nerve and stuff like that, because that's where a lot of the feeling and stuff, and there's a lot of damage that occurs with the radial nerve and dislocations. And also test for like the ligaments and stuff like that. If there's no tears or fractures, then usually there's no surgery required, and they're going to reduce it, as you kind of see what they're doing in this picture. And then after that, they're just going to arrest it, ice it, NSAIDs, and then try to get some simple rehab just to get a little bit of range of motion back while they recover. If there are complications, whether it's a rupture or a fracture, most likely then surgery is going to be required to just restore the normal alignment before we get into restoring range of motion. Types of prevention we can do is there's bracing, and this tape job you see right here is just a way to stabilize the joint and try to keep everything in place. Strengthening the muscles around it to try to stabilize the entire joint. And if anything, after their first dislocation, you may need to remove them from big contact sports such as football and rugby. There was no mulligan technique for an elbow dislocation. The PCOT analysis that I found is there's 20 patients with posterior elbow dislocations. They received this aggressive treatment plan where like they had no immobilization, it was reduced, and there was no surgeries needed, and they went straight into like nonstop full range of motion rehab. The comparison would be the uninjured arm, and then all of them returned to their range of motion was back to within 5 degrees of the opposite arm. There's only one person that had a redislocation. They were all able to pass their U.S. Naval Academy tests and made a full return to activity. And so this made them rule it as a very effective treatment plan for elbow dislocations, actually. And the timetable was they all were getting that full range of motion within 19 days after the initial dislocation. And these are my citations, so thank you for listening.